we explain HIV and AIDS. The human immune system defends the body against illnesses all the time. It uses guards in the blood called T cells to recognize any intruders and destroy them. But instead of attacking the body, the human immunodeficiency virus, or HIV, attacks those T cells themselves. It turns them into copy machines to make more copies of itself, then eventually kills the infected T cells. Without treatment, it takes 8 years on average for a person with HIV to develop AIDS, or acquired immunodeficiency syndrome. By then, there aren't enough T cells to fight off various infections and diseases, so it's not the virus directly, but the diseases that are eventually fatal. Humans first acquired HIV from blood contact with apes, and gradually transmitted it to more people through unprotected sex, used syringes, and childbirth. AIDS remained undiscovered until a sudden outbreak among gay men in New York and San Francisco in 1981. Very quickly, people began developing the same unusual symptoms around the world. The patients suffered from rare forms of skin cancer, pneumonia, or thrush, and few survived. Prejudice against homosexuality made research funding hard to get, and more people were getting sick. What could be done? Keep the virus from spreading. It became clear that the best preventive measure was safe sex, as condoms kept the virus from infecting others. Additionally, blood banks started testing blood, and new programs even distributed clean needles to drug users. Finally, in 1987, the first treatment against the virus was released, the ancestor of combination therapy. The medication still isn't a cure, but it keeps the virus from multiplying and destroying the host's immune system. By starting treatment early, people with HIV can now live long, healthy lives. Unfortunately, many people still lack access to medication, especially in sub-Saharan Africa. Over the last 30 years, about 36 million people have died, while 2 million more are infected each year. Scientists have made a lot of progress, but are still looking for the cure. You too can help end the AIDS crisis. Play safe, get tested, donate to support research, prevention, and care, and spread the word.
Welcome back to Point of Focus, and today with me in studio is Mr. Anderson Figueroa from the Voice of One Overcomers Club. I hope you viewers enjoyed our short clip on HIV, and he's here with me today on set to further discuss HIV. Thank you so much for joining me today in studio, sir.
Most welcome.
Yes, it's a pleasure. You're welcome. And, you know, HIV is something that we hear all the time, and, you know, especially among young people. It's something that's, I must say, has plagued society, if that's the word I should use. You can correct me if I'm wrong.
I'm listening.
But, you know, sir, can you tell us a little bit of what is HIV?
In a capsule form, HIV is just a sexually transmitted infection that a person would become infected once sexually active with a person who is infected with HIV. So that should debunk all the isms about cups and toilet seats and, you know, the normal,
Yes.
run-of-the-mill things that we would normally hear.
Yes.
So you know that HIV is sexually transmitted, and once you are engaged sexually with a person who is HIV infected, and the person knowingly or doesn't know they have the virus, that is the way you transmit it.
And, you know, there's a lot of conversation in terms of there's a difference between HIV and AIDS. Can you tell us a bit of that difference?
Theoretically, there has been debate about, you know, what is HIV, what is AIDS,
Yes.
and, you know, CDC might tell you something that HIV is one virus, AIDS is a combination of viruses. So basically that's it, you know, HIV is the one virus that they call the human immunodeficiency virus, and AIDS is acquired immune deficiency syndrome. So you have acquired a number of deficiencies or diseases that is attacking your immune system,
Yes.
while your immune system is being attacked by the virus that they call HIV.
So HIV, how long does it take before it develops into AIDS?
That is also another thing that is debatable, and you have different views from different people.
Okay.
It depends on the person, the person's level of how they maintain themselves.
Yes.
A number of other issues, but it all relates to, because remember it's about the immune system. So some persons might be HIV infected. You might have somebody come and say to you that they were infected and they didn't know, and it's like about 10, 12, 15 years pass, and eventually they realize that they were HIV infected, and if they try to retract, they might be able to trace, where it started.
Yes.
So some people might come and talk to you about a window period infection, might say 3 months, they might say 6 months. So it's debatable, it's theoretical, but the reality is that HIV is something that doesn't pops its head up, from the moment you are engaged
Yes.
with a person who's infected.
And how can someone tell if they are infected with HIV? Because as you stated earlier, sometimes it takes years before one discovers that they are infected with the virus. So how can one say? What are some of the symptoms in terms of, I can be?
Symptoms and stuff, well, of course, theoretically people would say a lot of things.
Yes.
About symptoms, about flu-like symptoms, about glands being swollen. You'll hear a lot of things about that, but the best way to know if you're HIV infected or not is you have to be tested. And testing is the only sure way to know if you are infected with HIV or not. Other than not being tested, it's just an assumption, and everybody have assumptions and opinions.
Yes.
So there's a way to see that this person is infected by being tested. So testing is the only way that you would know.
If you are infected.
If you are infected, other than that you don't know.
Yes. I know, Mr. Figueroa, one thing that I've heard, rumor has it that a lot of, university students, and especially in the Caribbean, there's a high percentage of HIV, students being infected. And what are your thoughts on that? Because from your organization, how do you address HIV in schools or even amongst young people?
Well, HIV in schools or among young people or adults, to me, in my humble opinion, in my corner of the world, I would say, it's all about behavior. We are sexual beings, we will become sexually active. A child as young as 9 would start to be curious about sex.
Yes.
Especially if that child is in a particular environment, in social, we call it the genogram or the eco-map, looking at a person's surrounding, how small it is, what they're exposed to, what they are hearing at night. So there's a number of things that would tell you why somebody could become sexually active before time, if this is before time, or after time. So, becoming infected, as you asked me, yes?
Yes.
How does one become infected with HIV? You have to become sexually active, but then I would share something with you on that point, however, which I think is in my opinion, is of importance. Because being a sexually transmitted disease, sometimes, because we are emotional beings, we would tend to want to do things in secret, relevant to sex we're talking about.
Yes.
So you might have a good husband or boyfriend or something that you have been steady with all along, but some Mr. Nice Guy or Miss Nice Girl come along the scene with probably all the things that they were promising you that perhaps you have desires of getting, and the person you are with not providing such. And now you take a chance somewhere, perhaps in the Bahamas or in Tobago, you went somewhere where I think nobody knows you, nobody would see you.
Yeah.
And you believe what you have committed was a secret act.
Yes.
But the amazing with HIV is that there is no secret in sexual activity when it comes to HIV. Because eventually down the road you realize that, hey, I'm now infected because of what I thought was a secret. And now what you have done, you have endangered the lives of persons who are not yet born.
Yes.
Because perhaps you might want to become a wife with children and etc. So the secret acts of sex, practiced out of, in one further words, a covenant partner, a partner that you are committed to. That secret act is no secret, so there is no secrecy really in behaviors that would, you would demonstrate you would be engaged in sex. So a person becomes infected based on, their lifestyle. It's all about sex.
Yes. And there have been a lot of conversations in terms of transmitting. You said, of course, sexual activity is is the main way of contracting the disease. And you hear a lot of young people saying, what about kissing and what about touching? And there are all these things that fly about. But what are your thoughts too, just for our viewers and our young people who are looking on?
I think it was either before we went on. I think I was discussing that people have a lot of things they would say about HIV. You know how you would get it and people would talk about if you have a cut in your mouth and this person kisses you and the blood is transmitted,
Yes.
you know, and then science will come and say, well, there is some level of possible transmission of the disease and etc. etc. But at the end of the day, really, HIV, in my humble opinion from my research for the past 15 years on HIV, because one of our primary focus areas within the Voice of One Overcomers Club is to address HIV and to provide what we call psychosocial support, which is being able to provide that counseling or that
Yes.
pastoral care for persons who are infected with the disease as to how to overcome and how to live a full life, because HIV doesn't mean that you have a death sentence over your head. All right? So, you know, all these things that you have been hearing about mosquito bites, they talk about injecting drug users, how realistic it is, how
Would
realistic
need-
is that in our country?
Yes.
Trinidadians are afraid of needles, so how realistic? I'm not saying that it might not have the little splinter groups that might be exercised using the needles
Yes.
for drugs. And then you have programs like in developed countries, as they call them, that you would be able to, like how they distribute condoms, they distribute needles. So if we do have a problem with needles here, then just as how they are distributing condoms, with the hope that persons will use it consistently and correctly, they should also be distributing needles if we do have
Yes.
a needle problem here and a transmission of HIV with the use of needles. But in my opinion, from the research, perhaps somebody could show me whether I have researchers to say we have a problem with HIV where a person was French kissing with another person and the virus was transmitted, or a person was using needles and the virus was transmitted. All I could recall is that persons who are infected, they were sexually active with someone who is infected.
Yes.
Or, unfortunately, at times you'll have a mother who is infected who could possibly transmit the disease to her daughter or her son, her child, if that person wasn't admitted to care
Yes.
in the appropriate time and the relevant treatment or medication, we'll call it that, has not been administered to that person in the last trimester to prevent that disease from being transmitted.
And Mr. Figueroa, can you tell us a bit about statistics for the past 2 to 3 years in terms of
Yeah.
young people? Can you tell us if there has been a rise in HIV or a decrease?
I would say this. If you listen to the different ministers of health,
Yes.
you're quite young, maybe about 17, 18 years
Thank
old.
you very much.
But what I'm saying is that over the years, you had different statements coming from different ministers of health.
Yes.
And of course, they are being fed information by different persons who say they are on the ground gathering data about HIV. And you would realize that the data is real skewed. It's not making sense. We try to connect the dots. So what I'm saying to you in a way, directly and indirectly, is that I really cannot answer that question.
Okay.
I know that there are young persons who are infected because I have carried young persons to the Mount Hope facility where they are being treated, and then when they reach up 17, 18 years, they transfer them to the adult treatment sites. So there are young people who are infected. Some were born with the disease, some became infected because they became sexually involved with somebody who had the disease and just transmitted to them. So when it comes to data, in Trinidad, there's a problem with data. That's the reality. If you talk to the Ministry of Health this year and you talk to them 2 years down the road, you would realize that something is not making sense.
Yes.
So the data gathering, and then of course we have all the different barriers to hide behind as to why the data is not correct. There are barriers to defend our inefficiencies or deficiencies in correct data gathering and presenting the absolute truth or as close as truth as possible
Yes.
to persons, the number of persons infected. Because you would hear persons say 14,000, some would tell you 27,000. Which one is true, really?
Yes.
And that's coming from persons who are supposed to be at the top.
So there's not really a fixed figure in terms
To me,
yeah.
young lady, Miss Sarah, I'm saying that I cannot answer that question to tell
Yes.
you, well, X amount, because somebody might come and say, that man giving you dubious, false information. Let them come and present that information to you. And then we could now question that as to how they get that data.
Yes.
Because they have a problem in data gathering, Ms. Sarah. There's a problem with the Ministry of Health in gathering data, be it on HIV or any other disease that we have affecting our citizens in this country. There's a problem with data gathering. There's a politics that takes place in gathering information and for the dissemination of the information for the benefit of the population.
Right.
And once we are playing politics with things like that, we are in a mess, and that's the reality of it.
Okay. Very interesting to know what's going on in terms of statistics and, you know, especially for organizations that are looking to focus in on specific diseases in the Caribbean. I think that's where a lot of the groundwork, you know, they'll have to really come together and work a lot hard to get that information.
Well, the challenge with data gathering, another challenge that we would have, it comes down to the reality of the resources to support the projects like gather data and exercise to know exactly how many persons in central Trinidad are HIV infected, or how many persons in Trinidad and Tobago are HIV infected. If you go from region to region, from the health facilities, you'd realize, and then you have to ask the question, are they checking one person a number of times?
Yes.
You know, these are the realities of what is happening with data gathering and etc. So once we address these realities and we come, you know, to what is really affecting us as a country, then I think we will try to put things in place to avoid all these
better measures in place. But would you say that the government or even different organizations within Trinidad and Tobago are not putting proper measures in place to address HIV?
In my humble opinion, once HIV is being looked at not as those people across there, and it's being looked as an issue that needs to be addressed for the sake of those people to come up, the unborn generation, then we would try to have the right policies and the right measures being put in place. But once we could sit behind in our nice offices, well-air conditioned and stuff, and speak about HIV, having been given data from somebody who has been sitting there for a number of years, really not doing the groundwork to understand what is happening in the communities, be it squatter settlements. Economical hardship causes persons to do a number of things. And economical hardship is one of the things that would flag as a reason why young persons might become sexually active too early. So, you know, it's all about...
There's a lot of factors that come into play.
And it's about removing from the mindset of the policymakers and from the mindset also of persons who are running NGOs that HIV is not about those persons across there who are infected.
Yes.
HIV is an issue that affects human beings. It should be addressed with relevant policies and relevant action. It's more than policies because there are a lot of lovely policies, but there's no action to follow up. And once actions are, and another challenge is when actions are stymied, when actions are held back, prohibited to move forward because a major issue is about professionals. Sometimes professionals are the greatest challenge to overcoming some of our challenges.
Right.
Because sitting behind my desk as a professional, well, listen, you see what Sarah Norman saying, that is madness. You need to know how to cut that off because you're talking crap. And I'm the professional here. I'm Dr. So-and-so. So I know what is happening. But he or she don't know what is happening because they have not been on the ground, really.
Yes.
Really been on the ground to know what is happening. And then they don't engage the foot soldiers in a genuine way to encourage participation, meaningful participation, and really listen to understand what is really happening. So yes, our young people will be challenged with HIV based on their behavior, based on what is happening with the media, what they are being influenced by, based on economical hardship. There are a number of factors. But it comes down to that individual having self-control and recognizing that there are consequences to actions, consequences to choices. So you choose. You create a vision for your life, you establish a plan, and you work towards that. And irrespective of what it is, you need to be determined. You need to know that along your way of going towards your goal, those are the young persons, that challenges would come your way.
Yes.
But you need to be courageous, you need to be strong, you need to be determined, you need to know why you want to be what you want to be. And therefore these obstacles that would cause you to have problems would become less and would have a less impact.
And that's why being focused is so important. But Mr. Figueroa, you know, can you tell us a bit about some of the solutions, some of the measures we can put in place as young people so that we too will not be infected with HIV? What are some advice? What are some advice you give to our young people who are looking on, even parents as well, for their children?
I would put it in one way and I would try to break it down in a secular way.
Okay.
The problem in life, the problem in society, the problem with us as a people, we have chosen to be rebellious. We have chosen to disobey rules and regulation. we have chosen to not look and recognize and respect and appreciate values, traditions that have protected the older generations. Now, I'm not saying that what is happening now started a while ago.
Yes.
And kept, snowballing. But the individual has that personal responsibility to protect self, to understand who am I, what is my purpose, and how can I ensure that I protect myself from because there are numerous challenges that
Yes.
with being here. So the advice is, be yourself, be focused, know what is respect your traditions, respect your values, because each religious institution and each home in this beloved country of Trinidad has some member of the family that would be willing to transmit some moral values, some spiritual values that would protect and develop the character of the individual, which would protect that individual. So all these terms that psychologists and social workers don't want to use, it comes right back down to values and principles. Do I respect myself? Do I respect the condition of a covenant relationship between a man and a woman? Or do I respect the views of, okay, this one have 4 women and plenty more, who am I allowing to influence me?
Yes.
What is the end result of such an influence? This is what must be looked at. So behavior change is of great importance, and once people don't understand and don't support sustained behavior change, then we just dance on top of it.
And I think everything comes back to that, your purpose and finding who you are. And, really discovering yourself as a young person. Yes. And my final question to you before we take our short break is, if someone is looking on and they are infected with HIV or AIDS, can you tell us what help is there for them?
Well, they have help. There's help available. They have medication. They wouldn't have no problem in, sustaining their life. They have free medication. You have places in San Fernando, places in Port of Spain, places in Grandy where they could access, treatment. Then there are support groups around. You have persons who are providing that psychosocial support. You have those who have been trained as professionals. You have those who have learned from experience.
Yes.
So there are persons willing to provide that helping hand as you journey through this new experience in life, from what perhaps your choices have, positioned you in. So here you are now, HIV infected. You now need to continue journeying. How am I going to continue this journey until such time when I'm no longer in flesh?
Yes.
So there are persons who are out there willing and able to assist you in making that journey. And when it comes to medication and treatment, there's that available as well.
Well, I'd like to thank you very much, Mr. Figueroa. Thank you again for joining me today to discuss HIV. So let's take a short break, and when we come back, we'll be joined by some young teens as we get their views on social issues. So you're watching Point of Focus. We'll be right back.